The topic is PE, ejaculation, premature ejaculation. And of course, Dr. Chancellor is giving us some information in reference to the prevalence of this problem. And he's also going to talk about some of the areas of treatment in reference to it. And of course, Dr. Chancellor, let's pick up where we left off during that second segment and have you to give us some additional information in reference to the things that we've talked about.
Well, Dr. Haney, sexual problem affects both partner in the bedroom. So the two most common for men, one is erectile dysfunction, or ED, can't get an erection. It affects maybe 15 to 20% of men. But as we all know, it's more common as we get older. But the second condition, which people is really embarrassed to talk about, is premature ejaculation, or can't lasting long enough so the man and his partner can't enjoy the sexual intimacy together. That's actually more common. Maybe a third or more of the men says they really don't last long enough to make himself and his partner happy. And this condition affects men equally across the ages. You know, I could see the young men being very nervous in a relationship when they just got married, and they feel terrible because they feel like they can't satisfy their wife or their partner.
And so that's and that can be a real problem. And of course, now, about the age, I think you've indicated the age in which people might be impacted by this. Do you find that it's more prevalent among younger men, or does it change over the years or whatever?
And that's what got really interested in the science part. Clearly, erectile dysfunction is an older man problem when he has diabetes, high blood pressure, heart disease. But premature ejaculation, there's got to be something physiologic wrong, because men that complaints of it, it's always said, I've always had it when I was 18, 25, and I still have it when I'm 45, 55. So there's almost like a reflex or control is set wrong, and no matter what they do, they have difficulty without that reflex kicking in too soon.
And so are you saying that it might be simply a mind thing, a mental kind of thing that we might be impacted by?
It will definitely affect them mentally, because sex takes two, and if the ejaculation time is too short, it will make him feel terrible with self-confidence, and then more importantly, he feel like he can't satisfy his wife, his partner. But I think the fact they've almost always said, I've always come too quickly, makes me think that there's a physiologic reflex that isn't quite right. And these guys just have a problem with that reflex coming too soon.
Well, you know, I saw in some of the factual information that we had in reference to this that you can identify what you might consider some causes for this. What would you consider to be some of the causes for this problem?
Well, some of it is like mental. They're stressful relationship, and it'll affect them in the bedroom. We know that for men that can't achieve an erection or get it. But I think the real thing is that up until now, there's been no effective treatment. But men, when they say if they take an antidepressant, a serotonin reuptake inhibitor, one of the side effects is they can't ejaculate, and ejaculation. Connects the dot that the ejaculation is a reflex in the brain, and neurotransmitters can control that. So if you supplement it, you can delay that reflex.
And so that would be what you might describe as a method toward treatment.
Exactly.
Well, now, what kind of success have you had in terms of dealing with and treating this as an issue here?
Well, like I said, up till now, Viagra, Cialis been out 10 years, and we have very good treatment for erectile dysfunction. But however, PE, we don't have. So we use antidepressant as off-label use. So if a man says, you know, this has really been bugging me, what can you do? I've tried the exercises, the pelvic floor squeeze stop. I read the Master and Johnson book. Is there something I can take? Well, we can give them antidepressants. But then they go, well, it sort of works, but you know, I'm not depressed. I don't want to take lifelong antidepressant and to have the side effects with that. You can't, I don't want to fix one problem with the baggage of another.
Create another problem.
So it's really been very frustrating saying, we know the chemical, the serotonin, is important, and we know that the antidepressant can clearly delay the ejaculation. But my God, the guy's not going to take it for the rest of their life just to make some help them and their partner in bed a couple times a week.
And so you've got a supplement, I understand, that will, in a real sense, deal with this as an issue. Is that? Well, now, what kind of supplement is that? I mean,
like I said, I do clinical and research, and I realize men clearly needs help, and we know that the ingredients in the antidepressant can block this reflux. So I spend about 2 years in the research lab, and actually I'm created a model to mimic ejaculation, and then we tested the chemical and we found out that we can clearly delay it in this rat model. And after we did that, we said, the pathway toward the FDA is so complex. Can we find something in nature that's safe but that does the job? So that's why I'm happy to have found that a natural supplement can actually inhibit this reflux. And we've done the testing in the lab. We've done the clinical testing, and now the Prolasta is ready to go.
And you so now you have a product. You have an actual. Well, now what about this product? You call it Prolasta?
Prolasta.
Prolasta. Prolasta. And so is this a pill? Is it a capsule? How does it come? And how would an individual use such a capsule or whatever it is?
The most thing we know that if you go to the drugstore, health food store, GNC, that they always say take something for 30 days before you see an effect, a capsule. But that's not, a man can't handle that. If they need Viagra, they want to take it, they want to see the results in 30 minutes. Same thing with Prolasta. We had to figure out a way that for them to take it when they need it, it's got to work within 15, 30 minutes.
And so you now have it in such a situation, and I understand now you're introducing this product here today. Is that what you're saying?
Yeah, so that we develop into a rapid burst, like one of those tablet you put under your tongue and it dissolves in 2 or 3 minutes. Because if it needs to work, it needs to work now.
Okay, doctor, let's take this second commercial break, and then we'll come back and we'll give you an opportunity to further elaborate upon this wonder drug in a real sense, because if it works as you indicated, then it indeed is a wonder drug. And we'll be back with our audience following this very, very short commercial break. A wonder supplement. And we're talking to Dr.